Hello, everyone. Welcome. You are in the session Mandated Support New Strategies for Compassionate Support in Schools. On behalf of the American or of AFT and Share My Lesson, I'd like to welcome everyone to today's webinar. My name is Dr. Lisa Thomas. I'm a Senior Associate Director in Educational Issues. Before we begin, let's watch a short video from today's sponsor.
Today's webinars are brought to you by Waste Hero. Waste Hero offers 19 ready-to-use lesson plans designed to help educators teach recycling, zero waste, and circular economy principles. Access and download at wasteheroeducation.com. Start teaching today.
Waste Hero is a global education program that includes practical ways for students of all age groups to build responsible waste management habits through 19 activity-based classroom lesson plans offered for free to educators globally. Visit wasteheroeducation.com to download all 19 lessons for free and begin helping your students become future waste heroes.
Again, thank you to our sponsor, Waste Heroes. Now, let's do a practice poll question, sorry.
Lisa, we cannot hear you all of a sudden.
Because I did not come off of mute. You would think I would know how to do that after all these years. Now, let's do a practice poll question. All of our poll questions will pop up on your screen with an audio alert. How do you prefer to communicate? A, phone calls. B, text messages. C, face-to-face. Be sure to hit submit to answer your recording. To make sure your answer is recorded. I'm forgetting how to speak today. While you're answering, I'd like to introduce our presenters for today. We have Chelsea Prax, friend and colleague from AFT, and Jim Arey, an AFT national trainer. You can read their bios by opening the speaker widget on the bottom of your screen.
Thanks, Lisa. Is it my turn to take it away?
Well, let's take a look at the poll results.
Okay.
By and large, I think everyone prefers text messages. I know I certainly do. And now I'll turn it over to our presenters, and we will start with Chelsea Prax. And thank you for joining us today.
Thank you. All right, I'm going to put up our agenda, and I'm hearing that folks maybe need some more practice with poll questions, so don't worry, we've got them built into this presentation. Today, we're going to do a little bit of a review. If you've been to webinars on this topic before, we're going to cover some things. If you've never heard of the term mandated support, we're also going to do a little catch up. We're going to spend more time on some new data that was published in January 2025 and that some of you may have helped to contribute to by answering a survey. And we're also really going to pivot to think about solutions and to try to help structure some of how we call on educators and schools to think differently and critically about child maltreatment. I have on the screen here, thanks to our partners, and throughout this presentation, we will be calling out some really specific resources that we built with folks, but we also want to invite you into your resource widget at the bottom of the screen where you can find all kinds of goodies that we are going to reference in this presentation. All right, I'm going to push out a new poll question, so you should see it pop right up, and I'm also going to read it to you. Here it comes. All right, have you ever reported to Child Protective Services? This is an easy yes, no. We're curious, have you ever reported to Child Protective Services? If for some reason your poll question does not work, please drop into the Q&A and our back-end supporter, Natalie, will do her best to help you. She also dropped into the chat just a moment ago to tell you that you should hear an audible notification when the poll opens. I'm leaving it open because I know folks maybe didn't get a chance to practice with that first one. I want to make sure that you do have a chance to sort of orient yourself to this platform. And now I'm going to move us to the next one so you can get a sense. All right, I see that 60-ish, almost 60-ish% of you said yes, you've ever made a report to Child Protective Services. One of the things I want you to listen for in the data section of this presentation is whether that is the same as what we found on the survey. So you all just said 57% of you have reported. Let's find out if that was a national standard as well. Before we get into the data section, again, we're going to do a little bit of a review of some key concepts. So I want to share this really big idea of mandated support. First, I want to give credit to JMAC for Families, from which AFT is building on and borrowing this idea. And we're going to hear directly from Joyce McMillan of JMAC in just a moment. But I also want to name that there are folks across the country working in counties, in states, in task forces, working on grants, doing advocacy, doing transformation in the legal sector, all kinds of spaces that really coalesce around the concept of mandated support. And they're animated by these four things that I've got up here. So one, we really want to think about eliminating reporting that is not necessary to Child Protective Services. We want to elevate prevention of child maltreatment, not wait until we're already sure that it's probably happened. We really want to help people ground themselves in compassion and interventions that are supportive, as opposed to doing something because they're afraid of being punished or because they want someone else to be punished. And we really want to do family support, wrapping around the entire family unit, as opposed to family separation. So these are sort of four of the animating items. Again, we're going to hear from Joyce McMillan of JMAC for Families, and then we'll get a little bit more into the nitty-gritty.
My name is Joyce McMillan. I am the founder and executive director of JMAC for Families, Just Making a Change for Families. And the model of mandated supporting follows the idea behind Just Making a Change for Families. So currently, there is a trend of people who are mandated to report, who are speaking out and saying that being a mandated reporter does not work and it does not help to accomplish the goal of, quote unquote, keeping children safe. The people who are coming out and saying this are licensed therapists, they're doctors, they're pediatricians, they're obstetricians, they're teachers. So the idea of switching from a reporting model to a supporting model would allow people to ask for the support that they need without fear of being punished for asking. Schools could actually be a community support to neighborhoods that are in need of different concrete resources. Teachers really have a bird's eye view, to be able to see when something changes within a family, and to have a position to ask a question. Is everything okay? Is there anything you need help with? Families at the stage, the way things are now, would be reluctant to answer that question with honesty. But if we turn schools into support mechanisms for communities, it would look a lot different.
All right. I want to say thank you to JMac and to Joyce for that overview. And she really sort of quickly covers a lot of big ideas. And so we want to spend just a little time getting into some more of those ideas and what it is that animates folks really thinking about systems transformation when we're talking about taking child maltreatment really seriously. For this portion of the presentation, I'm going to turn it to Jim Arey, my super fantastic co-presenter. Jim, take it away, please.
Thank you very much, Chelsea. Super fantastic. I like that. All right, first, we're going to start by discussing what occurs when you enter Child Protective Services. And then first, we want you to understand 5 key factors that affect families and influence CPS. So we'll get into the nitty-gritty right now. First of all, child maltreatment includes physical abuse, sexual abuse, and neglect. And many families have challenges and struggles, as you're all aware of. Overwhelmingly, people are being reported for neglect, and neglect often resembles poverty, making it difficult for researchers to disentangle one from the other. So only a few states have laws that state that neglect is not poverty. And so the Child Protective Services mainly engages low-income families facing multiple hardships. So when reporting, then you report, okay, this is where educators usually chime in. Every 5th report to CPS in this nation comes from the education workforce. Up to 90% of these reports do not result in substantiation. Therefore, a significant portion of this reporting is fundamentally unnecessary. This situation is not neutral for kids. This is not neutral for families, and it's not neutral for educators. And by the end of this presentation, we want to hone in at the end on that, on the 90% in this presentation. So what happens after a report? CPS automatically decides to screen in or screen out. Approximately half of the families reported are selected for further investigation, and the rest are maintained on a sort of watch list and usually receive no services or support. So for those of you who are screened in, an investigation follows. This may include a visit to the family's home, where an investigator might search through the drawers or examine the child's body. They may also look under the beds, check in many other areas. They may review relevant records such as school, medical, police reports, as well as conduct collateral interviews with people outside of the home, including teachers, doctors, and family members, to get more information. The process is very invasive, it's very costly, and time consuming. Only a tiny fraction of these cases are ultimately substantiated. So with the focus on parental beliefs and behaviors rather than addressing poverty and social circumstances. After determination, this lengthy process is how CPS assesses whether children have experienced or are currently experiencing maltreatment. Generally, the primary action that CPS is designed and funded to undertake is, if the victim is identified, is to remove the child from their parents. CPS removes 1 in 5 children it determines to be victims of maltreatment. And while in the government placements, kids face a higher risk of sexual and physical abuse, homelessness, and lack access to health care than they did while at home. So how often does this occur? On any given day, the proportion of children in foster care per 100,000 exceed the proportion of incarcerated adults per 100,000. On any given day, there are more children in foster care than there are adults in jail. I've said a lot in a few short minutes. How much of this information, I'd be curious in the chat box if you would be able to put in how much of this information have you heard before during your training on mandatory reporting or on child maltreatment? And we're getting some into the rest. That's deep. Chelsea will dig deeper into those numbers in the next session in the data, but not too deep. But just curious in chat, how much of this information was part of your training on child maltreatment and or mandatory reporting? See, this was not included in my training. Didn't know about the comparison with incarceration rates. That's awful. You see that if you have heard this before, if you have not, this is new information. Not this deep. Thank you so much for your comments. So we can see that people are all over the board on this. Thank you so much for putting those comments in chat.
Jim, you've got something that's super close to your mic and it's ruffling, I think, every time you get a little close. I'm not sure what it is.
Okay. Chelsea, anything on what you're seeing on the chat?
No, this is all really helpful. I mean, I think this is a little bit of both and is what I'm seeing. I'm seeing folks say, I've never heard this. This is all brand new. And I'm also hearing folks say that this is not new to them. And yet it still is hard hitting. And I think it's important for us all to start with a really, informational sort of grounding. And I see Leanne, I hope I'm saying your name correctly, asking about where that data came from. I'm actually going to do two things at once. So we're going to ask you a poll question. Jim just covered a lot of information, and so we want to check and see how fast we're going. Maybe we're going too fast. We're going to do a poll question to see about that. And I'm also going to show you a book that brings up that specific foster care and imprisonment statistic in the first few pages.
So we're going to jump ahead and see how much of this information, this rapid fire information kind of stuck with you. So we're going to launch a quick poll, which will be right here. Oh.
Got it? I'll launch it. Here we go. All right. So y'all should hear a ding. And you've got a question about which of those 1 in 5 on the screen is correct. Jim just covered a lot of different quick stats. Did you catch which one was accurate? I'm having a hard time, Natalie, with actually seeing it, so it's going to be hard for me to read it. Sorry about that.
I could do it. Which of these is the correct 1 in 5? 1 in 5 children are engaged by CPS before the age of 18. B, educators make 1 in 5 reports to CPS. C, 1 in 5 Black families is under investigation by CPS. D, 1 in 5 kids labeled victims of maltreatment are separated from their families. And E, both B and D.
All right, well, folks are putting that into the poll. I do want to put this one on screen. This is Investigating Families by Kelly Fong. She's a sociology professor out of the University of California, Irvine. And that statistic on foster care and imprisonment rates comes directly from her book. All right, so we're gonna go to the results. I'm seeing that folks have all kinds of answers and possibilities. And so I want to make sure that you actually get the correct answer. Here we go. We are looking at both B and D. Educators are making every 5th report to Child Protective Services in the nation, and every 5th child after those 5 different steps that Jim just laid out. At the end of those 5 steps, CPS or Child Protective Services agencies come to a determination. They make a substantiation or not as to whether or not a child is a victim of maltreatment. 1 in 5 victims of maltreatment are separated from their families. Angela's asking again for the name of the book. This is Investigating Families by Kelly Fong. Whoops, let me go on screen. There we go. I will also try to type it in. I think Teresa said you can hear me when I'm typing, so I'll try to keep that quiet if I can. All right, we are going to jump into the next section. So Jim just did a fantastic job of presenting the national picture, and I want to get into a little bit more specific national picture as it is in education. So before I give you a whole bunch of data, one, I want to preview everything I'm going to cover is available in the slides, which you can download from this presentation. It's also available in the publication on screen, which is in your resource widget. This is a new publication from AFT put out in January 2025. We're here today to present some of our key findings and big data. All right, we've put it out in many different places. I wonder, did any of these reach you already? Did you see it? Thank you, Angela. Okay, Jim, can you see that? I'm not sure what's going on with my poll questions, but I can't actually see them.
I cannot see the results, just seeing the questions and the data points.
Okay, well, thank you for that.
I can read the question.
Thank you.
Which of these AFT communication channels regularly reach you? Select all that apply. A, e-newsletters for educators or school staff. Professional learning updates is B. C is social media. D, share my lesson blasts. E, American Educator Magazine. F, other.
Thank you, Natalie. Thanks everybody for making this a team effort. No idea what's happening on my end that I can see almost everything, but not some key parts. I'm going to share the results with you in just a moment. It looks like half of everybody on this webinar gets professional learning updates from AFT, and 40% or so of you are getting newsletters. Less of you are getting the magazine, share my lesson blasts, or check in social media for AFT stuff. Not a problem. No worries. We're glad that it's getting to you. It's good to know the best way to try to reach you. All right. So I'm going to cover some of these new national data. And kind of like Jim, I'm going to go through it pretty quickly. So we heard from over 1,100 educators across the country. You've got a map here on screen that shows you that we heard from more in some places than in others. 60% of our sample was teachers. 1 in 5 was a specialist of some sort, like a school nurse or a school counselor, school social worker. This is one of the largest, if not the largest, samples of educators talking about mandatory reporting and their experiences with it in the history of the research, but it's not representative. So we're pretty confident that these are solid data, but they are not representative data. They're not expensive data. All right, so what did we learn? 5 different things. Without saying anything that Jim presented, without necessarily having ever heard of Kelly Fong's book or coming to a presentation with us, we wanted to know, what do people think about mandatory reporting? And in particular, how does it work? Or how do you see it working? Educators told us that most often, they don't love it. It's not really solving the problems that you're calling about. In particular, folks said after a report, they see absolutely no change. They had a concern. The concern did not get addressed. Or the other most popular answer was the relationship that I had with this kiddo or this family was damaged in some way. They stopped speaking to me. They moved away. They don't go to my school anymore, etc. Second big finding, again, without coming to any webinars, without me telling sort of, what I think might work or diving deep into anybody else's research, educators said, absolutely. If our families, if our kiddos are facing child abuse and neglect, if that's a real challenge in their households, then they need more support. Overwhelmingly, folks are ready to go. People told us in open-ended comments, what do you report about? So for this one, I spent a whole lot of time in open-ended comments, putting things together in different themes. In many comments, folks mentioned more than one thing. So these are in order of what got mentioned the most. You can see at the top that educators the thing that most often prompts educators to report to Child Protective Services is suspected physical abuse. And one of the most common words that popped up that got added to that theme was bruising or bruises that they observed. Number two, kids with hygiene issues, kids who seemed dirty, who seemed to wear the same clothes over and over again, for example. Number three was chronic absenteeism challenges. And then all the way down at the bottom, we've got hunger, we've got suspicions of being a user of an illicit substance or being exposed to someone else's illicit substance use, and being alone. Again, you can download all of these. Just trying to cover some of the big ideas that came out in this survey. Educators said overwhelmingly they have been trained, but to take us back to one of those early, introductory activities, what is in the training is important, and folks have different access to, important information and data. We did find that most folks get training at the local level, so at the school, at the district. But we also can see from someone else's research that that training doesn't always lead to some of the skills that folks really want. So for example, we know that only about 10% of school counselors feel confident that if a child discloses sexual abuse, that they know what to do besides reporting. We're getting to the end of these key findings. Educators are compliant. The policy says, every state policy currently says that educators are mandatory reporters, and they report. Overwhelmingly, folks said that they considered three things when they are determining whether or not a report might be necessary. They think about their ethical guidelines for their profession. They think about the evidence that they have available to them, and they talk to other educators. This one was a little bit challenging for me. Educators only report rarely, which was hard to reconcile with every fifth report in the United States is coming from the education sector. So how can it be that so many of the folks who took this survey are reporting rarely? And so I did some number crunching on the back end. And it turns out that even for the average of reporting about once every 4 years does get us to the almost 1 million reports coming from the education sector per year. And so I have here on the screen a little bit about annual reporting rates. Did you report in the last year? As well as career reporting rates. And for both of those, it was pretty rare and uncommon in a given year, I should say. Here's where I will check back on the very first poll question that I asked, not that Lisa asked. We asked you if you have ever reported to Child Protective Services. It was under 60%. In our sample, 70%, 69% of our respondents had ever reported. So there's the check-in, the comparison there. All right. Again, we would really love to hear from you. I just presented quickly data from Nobody Wins, this 2025 January publication. Did I surprise you in any way? Please hop in the chat and tell us. This was information from other educators, presumably just like you. Did it actually sound or feel just like your experience? I'm not seeing anything in the chat, but I'd really love to hear from you. So I'm going to be patient. I'm curious.
Chelsea, there actually are a few questions. And so at the risk of repeating those in the time, I'm going to share one that you may want to address. This is from April, do most neglect cases also include parental substance abuse?
That's a great question. Was that the whole question?
No, I was just going to cover another one, but I think you wanted to start with that one.
Yeah, I do. Neglect in the national data covers a lot of different potential topics. I have never seen any data that breaks down sort of, 10% of neglect is about this or 5% of neglect is about that. It doesn't mean that it doesn't exist. It might just mean that I haven't reviewed it yet. What I can say is that I don't have any reason to think that adult substance abuse or youth substance abuse is high on the list of what gets kiddos and families reported to Child Protective Services for neglect. And I think the data that we have on what educators see that possibly aligns with neglect, hygiene issues, a lack of adult supervision, hunger issues. These are also, as Jim previewed, right, really, really similar to poverty. And so trying to separate out, is it that a child's family does not have resources, or is it that they're being actively neglected, is a really important question for actual compliance with the law. Lisa, was there another one you wanted to offer me?
I'm just going to kind of synthesize some of the comments, and a number of participants mentioned the issue around anonymity and who's required to either disclose, or there was a statement around we're not allowed to, reveal who we are, and then someone said that, we're required to report and no one can just go and make a report. So you may want to address the issues around anonymity and reporting of mandated reporters.
Absolutely. There were a lot of open-ended comments on the survey instrument about a lack of anonymity. Folks said, I was told it is supposed to be not just confidential, but fully anonymous under the law. And that was not, many educators told us that's not their experience, and led to retaliation, fears of retaliation, really, really concerned about how states maintain that level of anonymity as they are supposed to. The other part of what Lisa said, was about, so there's a phenomenon that's called gatekeeping. And I saw someone in the chat mention this, that at your school, you're actually told you don't report. And you're supposed to give your observations or give your suspicions to a designated person or a gatekeeper, like a school counselor or a school social worker. That is common in at least 1 out of 5 schools. Our data was sort of is imperfect for trying to get at sort of how common this is. It definitely happens, but is it 1 in 5? Is it 70% of schools? I've actually seen both from different national data sets, so I'm not sure what the best answer is on that. I do want to affirm that it's absolutely happening, and I want to name and critique possibly that is a challenge with the way that I've read a lot of state statutes, which imply that there is one individual whose professional judgment is required for compliance with the law. So handing off or trying to delegate that judgment to a professional at the school site is a complication and a challenge to the ways those laws are written. Okay, I want to sort of sum up where we've been in the first half of this presentation so I can help us pivot to the second half. Jim talked about what happens on the sort of to families and to children when they go through Child Protective Services. I talked about how educators told us on a national survey that they think about and experience and possibly participate in mandatory reporting. We're here because we really want to take seriously that child maltreatment is something we can prevent. And we want to cover what is it that schools and educators could possibly do differently and could possibly do better, especially with attention to one of the statistics Jim offered us. 90% of what educators submit to Child Protective Services results in no substantiation. That means Child Protective Services might go through all of the steps. 90% of the time for educators, they say, this challenge that you brought us is not the size or shape of the problems that our agency is supposed to address. And so that means that at least 90% of the time, we really need educators and schools to have different tools that address your very real challenges and very real concerns. And we want to get into what are some of the things that go into that space. All right, I'm going to start with a story. I have used the name Demaria. That is not this young person's real name. Everything else in this story comes from a real place and a real school system. And we're going to build towards understanding how this can be true for one young person. Jim, will you just read this real quick for me?
Sure. Demaria's teacher referred her to a pilot program run by the nonprofit that coordinates wraparound services at her school. When she entered the Resiliency Project, Demaria was homeless and not attending school. In 3 short months, her mother obtained housing, and the Resiliency team assured that all of Demaria's needs were met. She's been attending school regularly, doing well, and graduated out of the program.
Thank you. All right. So again, how can it be that school systems, some of them anyway, are getting to this? First, I want to do a really broad overview. under the mandated support umbrella, which is beyond education, we're going to try to tuck what fits within the education sector. There are 5 really big ways of thinking about this. Schools and educators need skill-based student education, especially related to sexual abuse. That can sound scary, but the data is really, really clear. You can cut childhood sexual abuse by up to half. 2, schools and educators need to be doing robust family engagement. Educators need comprehensive professional learning. We need schools to really do whole child programming and to take up JMAC for Families' invitation to support the entire family. And to sustain any of this, we will need policy change. So we're going to look a little bit more at each of these different components. Jim, can I pass it to you?
Sure can.
Thank you.
Were you going to do student education? I was going to do family engagement.
Oh, sure. Okay, amazing. All right, so here's what I want to say about this. The research, I think, is sort of incredible. If we talk to young people about healthy boundaries, about healthy sexual relationships, about how to protect themselves, not because we want to be victim blamers, not because we want to hold children responsible for not being preyed upon, but because we want them to be prepared in the world, we can cut sexual abuse by up to half among children. Schools already teach. This is something I think should go on the list. I want to name, I understand some schools, some districts, if they hear sex education, are horrified because they think, oh, you're going to teach them how to. No. That's not what the research says we need to be doing. We need to be teaching protective behaviors. We need to be teaching skills. So we're going to start with that one. You're right, Jim. Now I'm going to pass it to you.
Thank you. And thanks for those that are sharing their stories in the chat. Really appreciate it. Other people are able to see what other folks are going through. Family engagement. One of the many factors that shape student outcomes is authentic family engagement, and it remains a critical piece of the puzzle. And home visiting projects can cut maltreatment in half. And the goal of many of these home visiting projects is to provide educators with the training required to foster and build that trusting relationship, which is so critical for the student success and school improvement. So effective family engagement really highlights strengths over challenges and acknowledges what families excel in and what works well. So we have to assume that the adults in the child's life, whether they are social workers, teachers, librarians, parents, or anybody else, care deeply and mean the best and are doing the best. And so how do we partner and bring together our strengths as equal partners in the life of the child? And how can we connect to the families, to specific aids, or whatever those challenges are? And that is really the opportunity that we have available for us here, and connecting families to the aid for these specific challenges. On the PD level, professional development needs to cover different objectives. So we have listed some things that need to be on, that you can see on the screen. We want folks to grapple with cultural competency and the fact that, for example, families from different places already, parent in different ways, and that the norms and standards are different, and be able to be open to that and understand that. We also want people to grapple with bias and the fact that almost exclusively poor folks with low income are being reported to Child Protective Services, policing poverty. And we want people to have more of a connection to the ethical framework that guides their various professions in the educated sector, or the education sector. And educators need to be trained on the fact that CPS can be harmful. The most common outcomes do not focus on preventing maltreatment. Rather, they involve family separation. Additionally, we believe educators need clear avenues in your area to know whom to contact or refer, not necessarily CPS, but to connect those families with the support necessary for them. So, for example, in Demario's family was involved with the local resilience project, which Chelsea will address when she discusses community schools in the next few slides.
Thank you so much. All right, so we've covered family engagement. We've talked about student education. Now we're going to get into a little bit more around wraparound services and whole child approaches. So one of the things that schools and educators can do better and differently is early mental health intervention. In many, many ways, schools are perfectly poised for this. Now, some of you might be thinking, oh my God, one more thing we've got to do. Chelsea, why would you? Let me pause you. One, I know. I used to be a teacher, y'all. I know. Two, mind-blowing for me. For kids who get mental health care, overwhelmingly, they already get it at schools. That makes schools the de facto pediatric health institution, mental health institution of the United States. Should they be? We could get into a heavy conversation. That's a whole nother webinar. But today, they are. And so this advice is, let's leverage that. Let's do it well. As long as you're already doing it, let's do it well. So what does well include? One, we've got to screen early. Two, we have to rethink who's at the center of our planning. This doesn't mean we leave some people out because they're inconvenient or because they have the wrong label. It means we think about who is the most likely to struggle in our community and how do we make it the easiest for them to get to the front of the line, get them, to exactly who they need. Because if we can redesign our systems around the people who are most struggling, we're going to redesign it for everybody and it's going to be stronger for all. That's all I will say on this for the moment. We want to invite you to download our new resource with Mental Health America with specific examples on how early mental health intervention can look from your resource widget. It will also be on Share My Lesson moving forward. The second thing we're going to cover is around school meals. And for this, I'm going to take a moment and pass it to Erin Hissam at the Food Research Action Center. She's going to do a phenomenal job of quickly and succinctly explaining the power of school meals.
Hi, I'm Erin Hissam, a child nutrition policy analyst with the Food Research and Action Center. Food insecurity is a significant problem in the U.S. According to the USDA, nearly 14 million children live in food insecure households. But food insecurity is typically not a sign of poor parenting. Rather, it's a symptom of poverty, for which there are many root causes. Early in 2025, AFT's Nobody Wins publication highlighted that child hunger is a top concern, prompting educators to report families to Child Protective Services. But child hunger is rarely a sign of neglect or maltreatment. It is a serious concern, though, and one for which we have a solution. School meals, particularly when offered to all students at no cost, are instrumental in the fight against childhood hunger. Healthy school meals for all is the gold standard. Schools that offer all children free school meals see reductions in hunger, better attendance, improved classroom behavior, and academic growth. Offering all students school breakfast and lunch at no charge reduces stigma and raises nutrition equity. And free school meals support families, stretching household food budgets and helping families purchase better quality meals for their own dinner tables. If your state has not yet adopted healthy school meals for all, local programs can still make a positive difference in kids' lives. Eligible schools can participate in the Community Eligibility Provision, a federal option that allows high-need schools to offer school breakfast and lunch to all students at no charge. And every school can bolster school breakfast participation through breakfast after the bell models. These innovative service models incorporate breakfast into the regular school day, combating many of the barriers that prevent students from participating in traditional breakfast models. By allowing children to eat breakfast in their classrooms, you are ensuring that children have the nutrition they need to start the school day. And there are after-school and summer nutrition programs as well. These out-of-school time programs help keep kids nourished when school is not in session. Teachers play a key role in supporting students and their nutritional needs. Download our brief or visit frac.org to learn more about the power of school breakfast, school lunch, and out-of-school time programs.
Thank you to FRAC for putting that together for us and so quickly explaining complicated, big ideas, big programs, big possibilities really quickly. If you download the slides, I'm not sure that you will get the video, but you will get some of the highlights from what Erin just said. The last approach to wraparound services that I want to call our attention to, and it is by no means, 3 and done, but 3 for today's purposes, is around trauma-informed practice. If you know me, you might know I also coordinate AFT's trauma-informed training for educators. Psst, check us out in the chat. I will share my email so you can join us if you'd like for the next one. But we want to name that in addition to food, in addition to great education, in addition to family engagement, part of what we have to understand is the science of how adversity can change children's brains, bodies, and behaviors, and how we can support them through that. So here on the screen, we have a quick review of the science. These are the healing gestures from Futures Without Violence, a phenomenal AFT partner. But again, if you'd like to learn more, we tried to tuck it into a quick brief, and it's available for you in the resource widget with Georgetown University's Center for Health and Healthcare in Schools. All right. So I've presented, Jim has presented, here are all these different things that might come together. I want to name that a community school is more than just services. It's not just layering on. We have programs and programs and programs. It's really about democratic institution building where everybody who's in the institution, children and families and educators, all have a say. So it's not a great principal or a great superintendent adding on things that will work. It's everybody coming together and talking about how is this going to work for all of us? How are we going to make it work together? It's about collaboration, and it's really about doing some shared problem solving so that, for example, and we've heard this from AFT members, certainly. If you try a breakfast after the bell program, but people haven't thought about extra trash bags, or they haven't thought about the fact that yogurt easily squirts out onto carpets and creates new problems, if you didn't do it in conjunction with your custodial staff, you might not yet have a great program. You might need to come back and name, this isn't working well yet, and we need to continue to work together so that solving child hunger or addressing child hunger is something we're doing thoughtfully without making a new program. In a community school, it's folks coming together and saying that honestly, authentically, and working together through that. This is what's happening in rural New York, among many other places. So I want to call our attention to Rome School District in central rural New York. About 10 years ago, they came together. They said, we're going to be a community school. That's what we're going to do. They put all these different things together, and 10 years later, they have expanded to additional districts. They have an entire nonprofit stood up just to help run this set of programmings and strategic partnership to do deep, authentic, effective collaboration. And they are so successful at everything they're doing that they actually had the local Child Protective Services Agency come to them to say, hey, people answer the door when you come. People trust you in ways that they don't trust our agency. Can you help us do prevention better and differently? And so they started what they call the Resiliency Project. They did not blast it out to all 50-some schools in the community schools network. They started with 2. The 2 schools that they chose were pulling in some of the most vulnerable. These are 2 schools where over 1/3 of all of the families have already been engaged by CPS. These are 2 schools where folks are struggling with a whole lot of layered challenges. And they said, we're going to do our best to plug directly into services and supports without having to go through CPS investigations if they're not necessary as the middle agency. They have significantly reduced several problems, including kids not having healthcare access. They helped them get Medicaid. Kids not being housed. They helped Demaria's family in 3 months. That is an astonishing turnaround. If you've ever worked with unhoused families, that's almost unheard of. They have these partnerships. They have this infrastructure to get it done. They have an incredible vision of where we're going to go. So I wanted to share these ones with you. I want to thank the folks who are doing all of this work in the Resiliency Project and in Rome and beyond. They're also with us here, and we're hopefully going to have you all hear more from them so soon. Before we tell you what policy changes might make this come alive in your community, we want to ask If you thought, you know what, my school needs to do one of those things, or all of those things, or better, or differently, what would policy look like to help make it possible? All right, Joanne says, listen, we need a community school wherever Joanne is. I'm sure you told us earlier in the chat, but I don't remember. Any other policies that you can think of that might make this come alive, that might make it the default to support in your school and community, when we know that kids and families have real struggles that 90% of the time Child Protective Services will not take on? I'm seeing a lot of people give a thumbs up on this community schools front. People are saying, hey, I want one of those. Amanda's thinking broadly, if we've got everybody with breakfast, let's get them all lunch too. I love that, absolutely. Universal school meals can cover more than one meal at a time. Some states have done that. I love to see it. More states have considered it. Let's see if we get there. Kimberly is naming that collaboration is going to be absolutely necessary to make any of this work. Okay. I'm going to put some of my policy ideas on screen, not to replace any of your good ideas, but just to continue the conversation and to get us thinking. You might, for example, at the school level, have every single staff person get a palm card that says, oh, that's right, if this is my concern, this is who I can call. It's not necessarily going to be CPS. For hunger, for example, Erin has clarified, that's not something that needs to go to them. At the district level, you could declare a sanctuary. We are seeing schools and districts do this across the country in relation to immigration services. They have not said we're non-compliant. They have said we're rigorous. If you're going to come here, if you want to do investigations, if you want to potentially meddle with families, you've got to bring a warrant and it's got to have a name on it, and it goes through our legal team. Schools and districts could say the same thing about Child Protective Services investigations. We comply rigorously. At the state level, and I saw someone else think of this in the chat as well, we could remove punishment from the law. Perhaps if the goal is protection, punishment is not the way to get there. And we could talk about not trying to punish educators to participate in this system or threaten them to participate in this system. Because again, a lot of the time, it's not accomplishing what we mean to anyways. All right, I'm gonna push out our last poll question for this afternoon. If we're going to effectively prevent child maltreatment, collective action and commitments are necessary. We're curious about which of these approaches from this presentation you are most likely to tell someone who did not have a chance to come to this presentation, or maybe you'll invite them to the webcast. These are archived, you can come back later. We covered 5 different things, big ideas. Which one are you most likely to pick up and bring to colleagues?
I don't know if you saw that, Chelsea, but Joanne wrote back, Glass Manor Elementary Community School, Oxon Hill, Maryland is where she's from and the school she's at.
Thank you. I'm also seeing that folks were dropping in after school services. Angela likes the idea of a sanctuary. Ending civil and legal penalties could move us to a support model. Absolutely. All right. It looks like the most popular thing on our list is family engagement. And I really love that. Again, we want to encourage you to download our Brief with Healthy Schools campaign. They walk through a really specific family engagement program in Chicago public schools with families. It's not focused on maltreatment. It's not focused on health and wellness, but they are accomplishing incredible things. And we want you to have it in your back pocket as a potential resource. We're coming so very close to close. So I'm going to ask Lisa if there's one question that you think we should address before we wrap up.
Thank you, everyone. So yes, there is a question that I think is probably on most people's minds is AFT advocating for educators not to be mandated reporters?
Fantastic question. And it has a twofold piece. Part number one, educators are telling us you don't want to be mandatory reporters and your union works for you. So where states are interested in considering that change, we would like to help your state unions pursue it. Two, as long as it is the law, your union will not ever tell you not to comply with the law. Absolutely comply. Your compliance should be rigorous. And now that you know that 90% of what educators submit to CPS does not actually make it through to the substantiation stage, we want to make sure that we're introducing better, stronger prevention, not just intervention, into your toolkit.
Wow. That was a lot of information. Thank you for such a great presentation. And I've learned some things that I didn't know at the start. And so unfortunately, we don't have time for additional questions. And again, all of the resources that were referenced in this presentation are available in the widgets at the bottom of your screen. So again, thank you to our presenters and thank you to our audience for joining us. Please take a moment to download your PD certificate and rate and review this webinar on Share My Lesson. This feedback is important to our Share My Lesson team and helps influence our future webinar offerings. Registration is now open to AFT Teach 2025 and join us for more than 20 workshops on pressing topics. Sorry, I got to turn my page here. And topics that educators are facing across the nation. You can learn more at aftteach.org. We hope you enjoyed the rest of your evening. Thank you all. Thank you, Chelsea. Thank you. Thank you, Jim.
Thank you, Lisa, and thanks to everybody who's in. We really appreciate y'all being here and hope you have a fantastic rest of your virtual conference, because I know tomorrow and Thursday are lined up with a whole lot more PD for everybody.
Thank you, everyone, for hanging in there, and you all covered a lot of information in a very short period of time. Thank you.